Well, thanks for being here, everybody. We're here with Dr. Sadiq. I'm going to read her bio to you and then I'll toss it back over to her. But first, please feel free to type in any questions and comments you have for her in our Q&A panel. So if you're on a computer, that's the lower right-hand side of your screen, smartphone or tablet, touch your screen to bring up your control panel, circle with 3 dots, there you'll have your Q&A. All right. So Dr. Sadiq is a physician with over 25 years of extensive experience specializing in internal medicine and geriatrics. She's currently president and CEO of Western New York Medical, PC, which she founded in 2002. This multi-clinic and multidisciplinary practice focuses on primary care and disease management and prevention. In this practice, she leads a team of physicians and mid-level providers serving throughout Western New York, as well as providing inpatient services at several area hospitals and nursing homes. Dr. Sadiq is also president of Geriatric Associates LLP, where she serves as the medical director of acute geriatric service at Erie County Medical Center, and she's here with us. So, Dr. Sadiq, thank you. I will turn it over.
Thank you so much for having me, and it's an honor and privilege to communicating with the people and actually conveying what's important for me and all through these years. And I'm an internal medicine doctor, but I tell you one thing: we deal with all these medications all these years, and but we do not pay enough attention on our food. So when I was growing up, and when I was even in my medical school, we had a 6 months our courses. We just talked about the food. So I think that's how I really started emphasizing in my daily practice on food. Why the food is important, what we eat, that's extremely important. It actually affects our personalities, it affects our immune system, it affects our skin, our body, our heart, our kidneys. So doing simple things are very important. So we have to take inventory of our food, what we eat every day. Are we eating healthy or are we eating junk? Or that's very important. I also, my favorite saying is that we make plans for our life. We'll have a bigger house, we'll have a bigger TV, we'll have now we have a smaller car, we need a different model. What do we plan for our bodies in next 5 years, where we are going to be, how we are going to help our body? Because the children are growing older, and then after 30s, our body actually start behaving differently. The same food which I eat at the age of 30, my body will burn differently if the same food I will eat at the age of 32. So we have to start planning for our body. That's the main point. So every day at the end of the day, we should do accounts, we should do our auditing. What did we eat today? What did we do today? Good, which was good for our body. So I don't know how many have heard me before, but I will just start with my couple of things, 2, 3 food items, which I actually think is the most important and everyone should have it. And what are the reasoning of those foods? Why I'm stressing on those food I really put a lot of stress on those food. And that is number one is eggs. Eggs are 2 types of eggs. Again, the diet is very important. One type which you get it from you don't, you have to eat eggs of those hens which are eating organic, which are also eating good food. So the hens which are eating good food or organic food, they are the eggs we should be eating, or freelance eggs, or the hens which are fed the vegetarian feeds. We have to be extremely careful when we pick our eggs. So the vegetarian fed hens eggs are not very expensive. Organic eggs are little expensive, but I actually, and their taste is different. If you find nearby any farm, I usually get the eggs from farm, but eggs are extremely, extremely important. A lot of time people ask me this question, should we just do the white only or not eat the yolks? But I tell people, no, yolks are more important than even the white of the eggs, because the yolk has all minerals your body needs it, all vitamins your body needs it. So it's a full meal. If even I would suggest you can have 2 eggs every day, but it has to be organic or vegetarian fed hens. The hens which are eating vegetarian feeds, that's extremely important. We don't want the regular eggs which has a lot of junk they feed the hens, so we don't want that. So 2 eggs every day. Don't worry about the cholesterol, but discuss with your doctor also. But I tell my patient that it's good to have 2 eggs every day. It actually, what it's going to do is going to build your immunity. It gives you protein, it gives you vitamin, it gives you mineral, and 2 eggs, and then you can have the you can skip the bread, you can skip the cereal. Either these can be boiled or fry, but put very little oil, very, very little, I put a drop of oil. So if you want to, so that's one thing. So 2 eggs, that's my favorite food. Then, especially these days when we are talking about COVID, and not even this time, any other time, our body is prone to get infections. So we need to build our immunity, and eggs are one which can give you good immunity. So number 2, my favorite food is honey. Honey also, you have to be extra cautious what kind of honey you are going to get. Make sure that if you can get honey nearby any farms or any local honey is more important than the honey which you get on the shelf. So honey, people think that honey can increase their sugar. Also discuss with your doctor, but it usually does not. But if you take an appropriate quantity, maybe 1 or 2 teaspoon in a day, not too much, it will not raise your sugar, but it will be what honey does. It is actually anti-inflammatory. It works like ibuprofen. So it is good for your arthritis. It's good for your heart. It's good for your body. It's good for your skin. In old days, what they used to do was they actually, even now in some part of the world, they use honey to heal the wound. They have a little strips. They have honey on the top, and they put it on the infection. They put it on the cuts. They put on the wounds, and actually honey is actually extremely, extremely important. It actually heals the internal wounds. 90% of our diseases are because of the inflammation. Our body is sore inside. Our body is very sore inside. So we need to heal our body. So honey is a healer. Always remember, it heals the inflammation. So, and also it boosts your immunity. That's very, very important. And if we are going to prevent the further diseases which are due to inflammation, add turmeric in it. Turmeric, these days you can get from the capsules and all those kind of things. You can get the fresh turmeric. Fresh means you can get these powder or roots. They are roots. And nowadays it's getting very popular. So everybody knows it, so I will not talk that much on. Turmeric also reduces the inflammation. It's good for your arthritis. It's good for the inflammation. One more thing I'm going to talk today is how to keep our memory. What are the foods which will help our memory? Eggs are very important, honey is very important, but there are walnuts. Walnuts and almonds are good for your memory. So if you want to keep your memory in a good shape, do these. Eat these two walnuts are very good. If you see, the walnuts also has a brain type structure. So it's a, God has made this as a kind of a, walnuts are for brain health. So walnuts and almonds are very, very important for the memory. And you need to add some fennel seeds with that, fennel seed for memory. Little bit up, maybe half a teaspoon every day fennel seeds, 10 to 12 almonds, and maybe 3 to 4 walnuts. Not do too much. Too much is also, anything we do start doing too much is not good. We have to do appropriately. As I said, we can have 2 eggs, couple of teaspoons of honey, and then all these nuts which I told you. So these 2 things. If you want to keep your memory, these 3 foods are very good for memory. And also, one thing I must say, that sleeping early is very important for your memory, for your brain health. So if you sleep between 10 to 12, your body release dopamine, and that's really good for your memory, and you will have very less risk of having Parkinsonism. So it's very, very important. So I gave you the and then I'm going to give you a couple of foods which are going to give you your mood. They are mood elevator. If you want to be happy, I call it I call this food as antidepressant. It's a day someone where we are tired, we get depressed, some things are not going the way we would like to go, those things to go. So what I do for my life is I actually make a tea. I make a little bit of, we call it saffron. Saffron, they come from flower. Saffron, or saffron, whatever you call. Saffron, they are very little pieces, strings, very small strings. Don't put too much because it can give your heart, it has to be a pinch of saffron in hot water, put a little honey in it, and that will give you mood elevation. It actually literally is antidepressant. So, and along with that, blueberries and all these berries, whatever kind of berries, they are also very good for mood elevation. So I gave you some tips for mood elevation, some tips for memory, and some tip for journal health and immunity. I'm going to take any question at this time. So let's see if people have any question at this time.
All right, thank you, Dr. Sadiq. We have a couple questions that have come through so far. This first one is, what are your thoughts on tart cherry juice?
Tart cherry juice? Okay. Anything, this is again my advice. Whatever you take in your body, make sure you see what you are taking. When you take these juices from the market, you don't know how many they have put it in. If you take just cherries as it is, even if you eat 5 cherries, that will be better than having a whole glass of, or 2 glasses of juices, because they have preservative. They were in plastic bottles for on the shelf or in the freezers. But if you are taking just 4, 5, 3 cherries, that is much better than all these juices. So I'm going to advise everyone, live like a caveman's life. Live like we don't have refrigerators, live like we don't have freezers. We bring food and put it in our freezer, and then we thaw them out, and then we microwave them. Try to bring little at home. Try to not have don't put for too long in the freezers. Don't microwave it. These microwave and freezers and refrigerations, they really change the chemistry of the food. I actually literally don't, I would say I barely once in a while will use microwave. Our house, we do have microwave, but we really prefer not to use microwave. we usually it changes the chemistry of the food. So even the same thing with the freezer. So the answer to your question is very good, these juices, but try to take it as it is the fruit instead of in the juice form.
That makes a lot of sense. Thank you. This next question is, could you please comment? There's a study out of China that reports that people who regularly eat eggs have a greater risk of developing type 2 diabetes.
um I tell you, I have been a doctor now more than 30 years. So I have seen all these times when the studies will come and they will say, oh, don't eat this because it will cause increased cholesterol, or don't do this, it will cause diabetes. But you imagine if we do eat everything in an appropriate portion and don't eat too much, and our activity level is appropriate with our food, trust me, we'll not have all these diseases. So going back to the question is, everybody has, they're writing papers, and I cannot just say they're wrong or they're right, but I'm going to say what I have seen in my life, and I have first-hand experience. I have experiences with my patients, with my family. The people who were eating, my own father was eating 2 eggs throughout his life. And my grandma, my uncles, I've seen the eggs are an integral part of our diet. And they lived up to like 90s, mid 90s. My father was productive till the last year of his life. And he was like, all these tips which I'm telling you guys, they were like he was practically doing it, and I've seen many other people are doing it in my family and my patients. So eggs, I again will stress on 2 eggs, but organic eggs or vegetarian fed hen's egg. That's the important.
Okay. Thanks, Dr. Sadiq. This next person says, did you say get 10 to 12 hours of sleep a day? Sorry if I got that wrong.
Okay. I said no. My thing is that we should at least get 7-8 hours sleep. That's very important. But our sleeping time is extremely important. Trust me, nobody talks about that. But our sleeping time is the most important thing. Between 10 p.m. till 12 midnight, for 2 hours, our brain, our body produce dopamine. And that dopamine is something which we get every day. If we don't sleep today between 10 to 12, we will lose that quota for today. We will not get we will not get that tomorrow. Today, whatever we did not achieve it, we'll lose it. So if we don't sleep between 10 to 12 p.m., 10 to 12 a.m., between 10 p.m. till midnight, even if we sleep half an hour or we sleep an hour and then wake up, but sleeping at 10 is important because we should get some of the dopamine for the day, our quota, otherwise we'll lose it. I have seen I have seen memory problems. I have seen Parkinsonism so common, and it is worse. It is getting worse because we are up all night. We try to watch TV, and then when we watch TV, our sleep is disturbed. So are we sleeping at 1 a.m. or 2 a.m. or 12 midnight or 11? Even if 11 is fine, we still will get some quota. But I've seen when I talk to multiple people, they don't sleep at the right time. So I think we should sleep at the right time if we want to have the good memory till the age of 90, and also we don't want Parkinsonism.
Okay, thank you for that. This next one, this person wants us to know that they put a pinch of saffron in their cheek before exercising.
The question is, do they do it, or they're asking me, should they do it?
They're telling you that they do it.
Oh, great, excellent. But you know what, I would advise them to do it not before the exercise. There is a reason. The reason is because saffron actually it stimulates your body, and it actually, if you take a little bit too much of saffron, your heart will start racing. So in other words, medical terms, tachycardia, it can race your heart. And when you are exercising, you don't want to race your heart too much. So you just be either you, if you're taking very little, take a very pinch. It actually stimulates your body. So just be careful. But if you are fine, your body is tolerating it well. I tell people, you are the doctor. You are your own doctor. You know your body. So you know your body when it's how it's acting out. So if you're tolerating it well, that's fine. But keep an eye on yourself.
Okay, that makes sense. Thank you. This person says, been buying my turmeric in bulk from Spicy Bazaar on Sheridan. Okay, this is, can you comment on the advantages of black seed?
Oh, yes, that's my favorite. I talk so much on black seed that it is like sesame seeds. They are very they have little tingent taste, but usually it's tasteless. They build your immunity. They are actually are good for diabetes. They are good for your they are good. They reduce the inflammation. They are good for everything. So there is kind of a saying in our culture that black seeds are good for everything. It cures everything except death. So we should, but again, we should not do too much of black seeds. We can only take a pinch a day. That's it. A pinch. You put it on your salad or put it in the tea, saffron tea. I sometimes put it in the tea, or you put it on the salad or put on your food or chicken or anything, but only a pinch, not too much. And don't buy capsules because they are very expensive, and you will get preservative with that, so you are actually losing the whole purpose. You keep yourself organic, keep yourself close to nature. Whatever you are eating, try to eat those things original. Don't eat processed things. Don't eat things which they have changed the whole they change the food altogether. These chips and pretzels and all these things. I don't buy actually these kind of things at home.
I don't blame you. This next person says, I learned about Nigella black seed from your last presentation. Beyond using them as a chew, I would like to report that the seeds grow into fern-like plants with light blue flowers.
Yes, yes. I'm glad that people listen to me carefully, and they implement these things. Because another thing I must say, that the food, when we treat people with food, it takes sometime months or years. It's not like aspirin I take. Actually, aspirin was also, now they are making it through the chemicals, but aspirin was from a plant. It was a plant. Aspirin also came from a plant, and penicillin is from the plant. So those in the old times, they were taking these things, uh, this mint is so good for your digestion. So mint, so like lot of everything has the benefits. Spinach has a lot of vitamin B12. It is very good for the memory. Spinach is really excellent to have extremely good for the nerve health. If we want to keep our memory and nerves strong, we should start eating spinach. And it's also is very good. It builds up our red blood cells, so we do not get anemia. So these food were really really, but when we eat food, we actually change the chemistry. We cook them so much that they lose their efficacy, and then we put them in the refrigerator for days, and then we microwave them. Those things, that means nothing. We are actually harming ourselves more than benefiting. So next
Interesting
question.
points. Thank you. This person's wondering, is one kind of berry better than the others?
Okay. Each berries has a separate. Each berries has little different benefits than the other berries. So sometime, you know, people like blueberries more than strawberries. So all berries have a lot of vitamins, antioxidant. Whatever berry you like I am not fan of strawberries. I like blueberries or raspberries. So I that's my favorite. So I just had a lunch of strawberries. No, I didn't take the plate. There were strawberries which I didn't take it. So blueberries are excellent, um, and the raspberries are very good. Some people like strawberries. So they all have good qualities. So you can pick any you like.
Okay, good to know. Thanks. This next is low appetite. Is there anything in particular you can recommend for nutrients when I am hungry?
So she has low appetite.
I'm assuming, yes.
Okay, low appetite. So um, this saffron can really elevate your appetite also, because it's kind of stimulating your body. And you can, or you what you can do is have a warm water and put little lemon juice in it, lemon, squeeze little lemon, and that also will give you kind of a, your hunger will, you will increase your appetite. If you are not hungry, that will actually stimulate the body. And also grapefruit juice also, it increases your metabolic rate, and also that will increase your appetite.
Okay, thank you. This next is we eat chia seeds and flax seeds daily. What are your views on this?
Oh, I love it. Take it. Keep doing that. Absolutely. I have a good audience, a very good audience. I'm happy that they are
You do.
already on the good track.
Mm-hmm. Okay, this next is what do you think about Ayurveda or Ayurvedic medicine, if I pronounced that correctly? If I didn't, I'm sorry.
What is that?
Ayurveda or Ayurvedic medicine, it's Ayur, V as in Victor, ED as in David, A.
I'm not familiar with that.
Okay.
How you spell it? A-Y?
UR,
Uh-huh.
V as in Victor, E as in Elvis, D as in David, A.
Medicine?
Yep. Or Ayurvedic, DIC medicine. Yep.
I'm not very familiar with that.
All right, that's okay. We'll move on to the next one. It's what are your views on dairy versus soy or nut milk?
Okay. So dairy, the regular milk, um, first of all, it depends on the bodies. What some people cannot tolerate dairy, so they can go to the soya, or they can go to the uh, almond milk or nut milk or other milk. But dairy is, I mean, it has nutrient wise, the nutrition wise, the goat milk is the best. Goat milk is the best in terms of the nutritional value, then cow's milk, and then comes out almond, because almond milk is good. It has protein, but the protein level is not that much as goats. So they have their good and bad. Soya has protein also, and the vitamin, but on the top is goat milk, and then cow, and then almond and soya.
All
But
right,
it
thank you.
depends on the body, whatever their body like it or body tolerate it. But take it anything which you like it, or it suits you.
Okay, thank you. The last thing I'm seeing here is what are your views on supplements?
Vitamins.
It says supplements, but we can do everything, sure.
All right, supplements. So I actually, supplements are important. If we are not taking balanced meals should have your good 60% your protein, 30% protein, 30% fat, and 40% carbohydrate. But these days they say that go the reverse way because you want to lose weight. But I would suggest take some protein, take some fat. In fat, take olive oil or take olive oil is the best, or coconut oil. They are the best. Instead of putting in the cooking and change their chemistry, put it on your salad. That you need a little bit of oil also for your body, and then some carbohydrate. Take the good carbohydrates, but balanced. Take everything little bit. Okay. So when we are taking a balanced meal, when we take the vegetables, it has all the vitamins. But sometimes the lifestyle, also our life is such that we get so busy. I'm talking about myself. Sometimes I'm running, I'm rushing, I don't eat properly, and I will not be able to, put a lot of attention on my meal. So those days I do take myself also. I don't preach people what I don't do it. So I have to do it myself before I start telling people to do it. So some days I must admit that I do take a supplement, and those supplements I usually take multivitamin, and I'll take like chewable one because that's what I like it, and they're sweet, they're tasty. I can eat it, and then also I take vitamin D. Vitamin D is very, very important. These days we have sunlight, so don't overexpose yourself. Once you get the sunlight, you don't need the supplement. So the days when I'm out and I know I have enough of half an hour of sunlight in a divided time, so I don't take the supplement that day. But the day when I see that I'm too much cloud, this weather is cloudy or snow and everything, then I take supplements. So don't you do things not like, okay, if I have to take the vitamins, I have to take it all 1 2 365 days. But take it when you think that your meals are appropriate, they were a balance. You don't have to take it. Vitamin D is perfect example. If you are exposing yourself to the sun, make sure I'm on here. I will also advise people to use the sunscreen or use the proper clothing so that you don't get too much of the exposure and avoid the sunburns and the cancer. But at the same time, you need to get some vitamin D where you can be, which is needed for your bones and your bone health. And also vitamin D also makes you feel better. You will be happier and you will be having a kind of you will be more energetic if you are taking, if you have enough vitamin D. So level of vitamin D is also very, very important. Get the vitamin D level if you're feeling down. So going back to the supplements, so take it the supplements if you think you are not a balanced, your diet is not balanced. And if you are eating balanced, you're taking vegetables, you're taking eggs. Eggs yolk are multivitamin, and then you can still keep it on your dining table. Take it, infrequently or frequently. Uh, Adjust it according to your diet.
Okay, thanks, Dr. Sadiq. This last thing that I'm seeing here, I'm likely going to mispronounce, so please forgive me. But this person's wondering what your view on ashwagandha for diabetes and vision is.
How you spell it?
A, S as in Sam, H, W, A, G as in Gerald, A, N as in Nancy, D as in David, H, A.
Maybe the names I'm not familiar with, but on diabetes, I can tell people that on diabetes, there are some vegetables which are good for diabetes, and this one this may be a vegetable. I'm not kind of that sure about this, so I will not comment on it.
Okay. That's all right. We'll just give it another couple seconds here to see if anything else rolls in. And while we're waiting, Dr. Sadiq, is there anything you
Yeah.
want us to know before we close?
Sure, sure. I think I was talking about the vitamin D. So as I was saying that, if you're feeling tired, like I tell you, as I just said earlier, you are the doctor of your own body. You are your own doctor, because you have to see what is really bothering you. Do you have anything, are you feeling down, or are you feeling, when you are actually going to the shower, touch your body, do your breast exam for the female, even for the male, look at that if there is anything new on your body, and do spend 5-10 minutes on your body, look at that, because that is, you will lead your doctor on that. You tell your doctor. One time, I tell you a story. I had a patient who had a very little spot, dark spot on his forearm, and he actually told me, he said, Doc, I think this is a new spot on my forearm. And I was very impressed with that patient. I said, you know what? It looks like very little, maybe not even half a centimeter.
Dr. Sadiq, it looks like we're having some trouble with your connection. I'm not sure if you're still there or not, or if you can hear me. We'll just give it another second here, folks, see if she's able to come back to us. Dr. Sadiq, are you there? I hope we didn't lose her, folks. Sorry about this. Someone put in the Q&A that she's buffering. It's pretty funny. Well, we'll just give it another minute here, see if she comes back. And if not, we just appreciate your time today.
Unmute. Can you hear me?
Yes, you're back to us.
I don't know what happened. Automatically it happened. I didn't even touch anything.
I think it's just with your connection. Sorry about that.
No problem. So I was at the point that where I said that I try to bring less, do frequent groceries, and I know sometimes it might be tough to do frequent groceries, but try to have less in your freezers. Try to please avoid microwave. It's really can cause all these change in chemistry, and it can cause cancer. So any other also, if anyone who's having problem with the sleep, I will advise they can take a banana. Banana, I use it as a sleeper.
Thanks, Dr. Sadiq. We actually lost you when you were telling that story about your patient with the spot on his arm. If you
Oh.
could ever finish that for us. I'm sorry if you've been talking that whole time.
Sure, no problem. I will, I was saying that how important it is that we should keep an eye on our bodies, and we are our own doctors. We should examine ourselves, at least good look once or twice a month. For females, for women, I would advise them to do the self breast exam, look at your body, and anything new, any new bumps, any discoloration. And even for the male, look at that, look at their body, what's going on, is anything new, or any different, any change in behaviors, or any change in the mood. Sometime your mood is different. And I will tell you two stories. One story is a patient came to me and he said that I have this new color, dark color spot on my forearm. And it was like, maybe I was very small, less than half a centimeter. So I said, how long it will, she said it's very new. So I said, let's go send you to the dermatologist. I want to make sure that it's not cancerous. He went to the dermatologist. They did the biopsy. That guy ended up having basal cell carcinoma, but it was on initial stage, so they took care of that. This is so important. Another thing is, also watch what your moods are. Sometimes people are very lethargic. I have a very recently, there was a patient who was very energetic. I tell you, she was like in her late 40s, and she told me that she's feeling very down, she's depressed, and she had all the reasons to be depressed because of her some family situation was going on. So I said, I asked the questions to her. I said, but she, anyone, any other doctor would have said that she has a reason to get depressed because of the family reason. But I actually went one step further. I said, let's check your thyroid, because low thyroid, low blood, high blood sugar, low thyroid, and also low, when you are anemic, all these things can also cause kind of a fatigue and depression and fatigue and vitamin D level. So I just went ahead and did her vitamin D level, her thyroid level, her I checked her for anemia, and I checked her for sugar. So all these three things were fine, but her thyroid was so low that it was like thyroid, we call it thyroxine. It worked as a gas in our car. Imagine if we do not have a gas in our car and we are driving our car, what will happen to our car? It will die soon. People can have heart attack if they don't have enough thyroxine in their system. They will have anemia, they will fatigue, they can have massive stroke. So I actually started her right way on the Synthroid, which is a thyroid medicine, and she started feeling better right away. So your symptoms are very important. Anything new happening to you, bring it to your doctor. That you are your own doctor. So doctor would not know, you would know. So that is my extremely important message to all of you.
Thanks, Dr. Sadiq. I'm so glad that we had you back and we were able to hear that from you. I'm just seeing two more things. Is that okay?
Sure, go ahead.
Okay, this person's wondering if you can please comment on vaccinations and booster shots.
Okay, vaccination. Um, this COVID is, I don't know what words we should use for this COVID virus, because it is so volatile, it is so different, it's changing, and it's like not enough research has been done yet. So people are, the medical community are doing their best. So even people who have both vaccines done and they still are getting COVID, So people who did not have vaccine, they were living with the people who had COVID in the same room, in the same bed. They did not get the COVID. So I have so many interesting stories which I can go on and on for hours in this past year and a half what we went through. But there is no right and wrong answer for this. But I would suggest that getting vaccination is very important. Booster, we do not know. Some people are advising, some people are not. So I do not have any fixed answer for you. And also, I would suggest that eating healthy is very important. Keep your immunity and keep yourself safe by wearing mask around people.
Thank you, Dr. Sadiq. We have a comment that says, we enjoy her advice and try to follow it.
Good. Thank you so much. That is the whole, that makes my day, because if out of you, even if one person will follow the something what I said today, that is worth it.
Definitely. I mean, we appreciate you. And this last question we have is, what is black seed? Can you explain that to us, please?
Okay, black seeds, they can actually Google it. It's on Google. There is so much, but black seeds are like sesame seeds, like chia seeds. They are seeds like they are very close to sesame seeds, but they are of black color. Like chia seeds has their benefits. Black seeds have the same way this benefit. They also people can make oil of this. They crush it and they make oil of it. It has a lot of good, it builds the immunity. It's really good. It has a lot of minerals like chia seed has it, like sesame seeds has it. So, but this black seed is more common in the eastern countries than the west. So now it's getting, people like me are promoting this black seed because this is a food which is like really one of the best food uh, actually on the planet.
Wow. Okay. Well, thank you for sharing that with us. And now I'm just saying thanks for your presentation. Always look forward to hearing you speak. So, Dr. Sadiq, thank you.
Thank you so much. Thank you. Glad to be here.
All right.